So
Good
to start,
Good morning, everybody. Sorry.
good morning. Yeah, okay. So to start, you log into patient management and reporting system. Now, today we are going to look at the clinical management, and we have three types of clinical management: for HIV clinical management, the TB clinical management, and other clinical management for other STIs and viral hepatitis. Last week, we looked at care registration and initial evaluation. When a client is confirmed positive at any testing site within the country, the testing site will do an electronic referral for care registration and management. There are three types of referrals from the testing site. Clients who are confirmed HIV positive will be referred for HIV care registration and management. Clients that are confirmed TB positive but do not have HIV will be referred for TB care registration and management. Clients that have any other STI or viral hepatitis but do not have HIV or TB will be referred for other care registration and management. Clients who are under some prevention plans and are going to be put on PrEP or PEP will be referred for other care registration and management so that the ARVs can be prescribed and then they can be monitored for the side effects also as other clients on ARVs. We have done all of that last week, and so today we are going to move to two functionalities: the routine functionality and the clinical management functionality. For HIV clinical management, the routine functionality comes first. But for other clinical management, once the client is registered into care, you can skip the appointments and skip the creating a visit and go straight to clinical management. On the left side of this page is a pages menu. When you expand that menu, you will find links to several functionalities. The functionalities you will find on your page depends on the permissions that you have been assigned. Users assigned the routine permission will see appointment/patient monitoring submenu. Users assigned clinical management permission will see the clinical management submenu. So these two submenus are the focus for today. So we'll look at the appointments and patient monitoring. When clients are registered into care, for HIV care registration, there is an initial evaluation form that is filled for the client. On those forms, CD4s and viral loads are requested to record the baseline CD4s and viral loads for the clients on care registration. When that is done, the system generates flags for clinical management for the clients. Flags for when the next CD4 is due, flags for when the next viral load is due. The system sets the next CD4 date to be 3 months from the last recorded CD4 date. And it sets the next viral load date to be 6 months from the last recorded viral load date. It is not a hard rule that you must screen at those dates, but it's just a flag the system puts to remind you. If for any reason you feel like you need to change those dates so that people don't get confused, when you expand appointment or patient monitoring submenu, you will find routine test/reset dates. When you click on this, it gives you a page where you have all of the clients who are in care, the dates of their last CD4, the date of the next CD4 test, the date of the last viral load test, and the date of the next viral load test. Every date that is past or that has not been done will be in red, and every date in the future will be in green. This red and green flags is generated based on the timing of 3 months from the last CD4 date for next CD4 and 6 months for the next viral load date from the last viral load. If, for instance, you want to change this next date, the form above, you can take a unique ID here and decide that you don't want to screen this client. You do not want to do any CD4 tests, and you want these flags to be off. So I will put the client's unique ID here, and I will change the CD4 and update so that the date will be reset to the next 3 months. So this does not record any value, it just resets the date. So for any client you feel clinically you don't need to do a CD4 or a viral load test, you can reset their date by coming up there, and it will reset the date 3 months from the date that you reset this, so that you can have the flexibility of changing dates and making the flags notify you according to your timelines in the country. There are other monitoring functionalities for clients. Under the appointments/patient monitoring menu, you have the monitor clients functionality that gives you 3 different types of monitoring. The first one gives you the list of clients with the CD4s and the next CD4 viral load and next date. The second tab gives you a medication adherence assessment report. Now, when clients who are in care are coming for subsequent visits, they will see the adherence counselor who will do an adherence assessment to see if the last set of medications that they have gotten, they were adherent to. And we are going to look at that next week with the adherence counselors. And after we do that, then you see this page populated with adherence assessment reports. This report generates flags on the care card of clients to let the doctor know if this client is severely not adherent, if they should continue the medication, if there's any other course of action that needs to be taken. The missed appointment gives you a list of clients who has an appointment but did not show up for the appointment. This helps your follow-up to find out why they are not there. And in the events where a client calls in to cancel for a particular reason and has scheduled the appointment, you can go to update the appointment date so that the system removes the flag of missed appointments. This is just there for you to know clients that are lost to follow up if they are constantly on this list, and clients that needs action to be taken. So to start clinical management for HIV clinical management and to do a clinical management for exposed infants who become positive, you need to have the routine permission, and you need to come to the appointments/patient monitoring submenu, and then you click on schedule new clinical management/CD4/viral load appointments. If the client already has an appointment on the system, this is not going to give a new appointment. It will tell you the client already has an appointment and you should use the previous appointment. The system has no hard rule to the date of appointment. This is just there to help you structure things and to organize appointments so that you don't overwhelm the clinic days, so that you can completely collect all the data you need to collect and you don't bother about clients waiting endlessly. Whatever the date you fix for the appointment, if the client comes later, the client comes earlier, you can still access the records, but you want to set that rule within your country, if you are able to stick to appointment so that the clinic days are not so overwhelmed and you don't have incomplete data because you have to be in a hurry. So we'll put an ID for an adult for HIV clinical management, and I'll put the date for today. So this client that I chose is not registered into care. And so when you put in a unique ID for a client that is not on the system, it will give you this failure notice. Now I'm going to put in the unique ID for a client that is registered. And the reason for appointment is HIV clinical management, and the date is today. So you'll get a success message when the ID is correct, and then you click on OK. Once that is done, you can come back to your appointment/patient monitoring menu here and click on View Pending Appointments, and it will give you the list of all the appointments for the day and for future days. So you have the list of all appointments that have been scheduled on the system, and you know by date when a client is to visit. So we have this person for appointment for today that I just created. I am going to create more appointments for more clients that we'll use later on today. So I will get a new appointment for an exposed infant. And this is HIV clinical management. And I'll also create an appointment for a pediatric client. Now I have 3 different types of clients so that we can see the 3 different types of forms that will be generated based on the category of the client. There are 2 other types of clinical management, which is other STIs and tuberculosis. You do not need to schedule an appointment to have access to the care cards for those clients. But you want to schedule an appointment if you have the same doctor seeing both HIV and TB and other STIs. Or you just want to have an organized flow of things regardless of the clients. But the appointment is basically flagging HIV clients who missed appointments. Once you have scheduled all the appointments and you come and you view pending appointments to see the dates. Yes, all PEP clients will also be, you don't need an appointment for them. They are going to be referred under other clinical management. So once you have a client who is under a prevention plan and you are sending them to the ID clinic just to get prescription for ARDS and to also be monitored for side effects, you just refer them for others and they do not need an appointment, but you can create an appointment if you need an appointment to organize stuff. But they can have a day to go there. And the reason for this is appointment creation depends on having 2 levels of staff. You want maybe where they do a triage or they have a nurse who takes vital signs and then sent to the doctor. In the event where people go to private doctors and the private doctors are using the system, you don't want to give them that level of permission to be able to see other clients that are not their clients. And because of that, you want the release of the care cards for other purposes to be straightforward without the dependence of other functionalities. And so that is the reason for that break in the flow of things. So we have the appointments that are pending, and we are going to start with the adult. I'll take the unique ID for the adult. Once the client who has an appointment shows up on the day of the appointment, You're coming back to appointments/patient monitoring, and you are going to click on create visit. The create visit / record vital signs only records the vital signs to alert the doctor that this client is around and is waiting. But until this is done, the care card is not going to be transferred or released in the doctor's office. So let's take the temperature. Let's assume that this person is very sick. And the blood pressure is, let's do this. The pulse is 100 beats per minute. Respiratory rate is 22. The weight is 165 pounds. The height is, let's say, 183 cm, and the BMI is calculated automatically. Now you notice that when you put 1 unit, the system automatically converts to the next unit. So you don't have to put any the different units of measurements. Just use one and use the button to convert to the other if you want to have a different unit. But when you come to the height and length, the algorithm the system uses to automatically calculate the BMI is the weight in kilogram and the height in meters. So you want these two fields to be populated. So if you put your weight in pounds, you want the system to automatically convert it to kilograms. So anytime you put a new value here, you move to the kilograms, it automatically converts. And when I put a height here, and I move to the meter, it automatically converts. And when I move to BMI, it's recalculate itself. So this is all you have to do on this form. If the client is a child, then you fill in the head circumference, the chest circumference, and if you want to check for malnutrition, you want to do the mid-upper arm circumference. But this client is an adult, and so I'll click on send. Once this is done, the doctor now will come to the clinical management functionality and click on waiting clients. Now you will see a list of clients whose vital signs have been taken and they're just waiting to see the doctor. This client has the vital signs just taken, and it is time for clinical management for this client. So again, you come back to clinical management menu. When you expand that menu, you would see waiting clients, HIV care card, TB care card, other care card, and previous encounter. When the purpose of visit for the client is HIV clinical care, you are going to HIV care card. And then you put in the unique ID of the client and get forms. So this releases the care card of the client for clinical management. On the care card, you have the flags of when the next CD4 is due and when the next viral load test is due. It gives you information if the CD4 and viral load test have never been done or if it's overdue. Again, the flags are generated based on a set algorithm of 3 months for CD4s and 6 months for viral load. You can update this or you can ignore it if you don't follow that rule in your country. It gives you other alerts here for the clients. It will give you the trends of CD4 and viral load values that has been recorded on the system so that you will know if the client is having a lower CD4 or higher or a lower viral load or higher. It also gives you the BMI trend to see how the client is gaining or losing weight over time. And then it gives the adherence assessment report if that has been recorded by the counselor before the client walked into the office. If there is an upload or recording of the drug resistance testing for the client, it's going to be displayed here. And then we have the basic demographic information of the unique ID, the sex of the client, and the current age. And then the vital signs that was just recorded. If for any reason you want to repeat the vital signs, and Karen, this was what you suggested yesterday, I have included that. There is the first tab is the vital signs tab, where you have a trend of vital sign values and the form to record new values if you want to retake the value, and all of this will be updated. Okay. So all of this will be updated once you record new vital signs. This only displays the most recent vital signs recorded. Then if you were here yesterday, you will see that this is less populated. And I made that change based on recommendations. For these clients, we have adult or adolescent symptom review. The symptom review gives you a form where you record presenting complaints, the new problems, your assessments, your plan, the drug and the regimen that you are going to record. The TB symptom checklist is the basic symptomatic check for TB. We have the update viral load or CD4, where you put in new values if you have new values. The adult or adolescent clinical staging, where you select the clinical stage based on symptoms. The HIV adverse drug reaction, where you select the drug reaction for clients already on ART. The mental health assessment or evaluation. The treatment, so you will record the drug you are prescribing, the regimen, the dose of frequency, the duration, and any extra notes. And then you will find the treatment history here. And above, if the client picks up the medication from a pharmacy, it will be displayed here. Then you have a tab where you can view uploaded investigation reports and view HIV drug resistance information. Yesterday, when we looked at this form, we had all of the forms for tuberculosis included in this. But because it is going to create more confusion and overcrowd the page, I have left that out. So when a client is HIV positive and needs to be treated for tuberculosis or has active TB, you will come back to your clinical management and get the tuberculosis forms for the clients by clicking tuberculosis care card and TB care card. And when you click on TB care card, all you need to do is to enter a unique ID. So enter one. And get care card. So this gives you just tuberculosis forms and gives you all of the forms from the health center where all of the information for the client has been recorded. So you see the personal information, the risk factors, the comorbid information, HIV screenings. If the client had HIV screenings, you'll see the result. The TB screening that was done before referral, the syphilis screenings, if any is done, you'll find it here. Other screenings, contact listing, and extra notes. You can upload screening results. Then you fill in the TB registration information, the symptomatic checklist, which is the same as you find on the HIV care card, the diagnosis and category, the drug resistance testing for TB, the treatment is the same as that of the HIV, the treatment monitoring, the adverse effects and effects management, previous symptom checklist. If you fill in a TB symptom check, you'll find a previous symptom checklist, the vital signs and statistics that has been recorded. And if you want to record new one, you have the form to record that. Yes, for TB care plan, you can use exactly the same unique ID. So on this system, if they're making multiple referrals for a client, you want to make sure that you're using exactly the same unique ID throughout so that you don't have duplicate accounts for one client. So if the client is going to be attending multiple clinics, let's say in countries wherever they do the TB treatment and the other STI treatment is not the same place with the HIV. You want to make sure you do the referrals using the same unique ID as the client, so that in the event where the same doctor is going to treat everything, you are just accessing the forms using the same ID. So let's fill in this TB before we move back to HIV. The first line of tabs are all the files from all the health centers that the client has visited in the country. You just have them there in case you need to update anything or you need any information, but you don't really need them. The first form you need is the registration information. So this is a one-time thing that you fill in for new cases that were referred. So have you ever been vaccinated with BCG? Let's say the client says yes. Have you been treated previously for TB? We'll say no. Have you had an abnormal X-ray suggestive of TB? Let's say no. Do you take greater than 15 milligram per day prednisone for greater than 1 month, or currently taking prescription arthritis medication? Let's say no. Are you a resident or current employee of a high-risk setting, correctional facility, nursing home, homeless shelters, hospital, or other healthcare facilities? Let's say no. And then you save this. Because this, sorry, I didn't fill in the first field, the record date. So you always have to put in the date when you fill the information. So the date is 15th of February 2022, and I'll put the value back. Okay, so because this is a one-time form, the values are retained for whenever you want to update the form. You don't need to update this frequently, except there was an information that was missing or something was filled in incorrectly. Then you move to the symptomatic checklist. This is an encounter form. So once you fill the form, it clears up for new values for the next visit. So I'm going to fill in this. So coughing for more than 3 weeks, we're going to say yes. Persistent fever, yes. Coughing up blood, no. Excessive night sweat, let's say yes. Harshness, yes. Chest pain, yes. Fatigue, yes. Loss of appetite, yes. Unexplained weight loss, yes. So has the individual been previously diagnosed or treated for TB? We'll say no. Has the individual been in contact with a person known to have TB or long-standing cough? No. So if you have yes to one or more of these questions, then you go ahead to fill in the last row of questions. So in your own assessment, is this client a suspect or not suspect? So we'll put suspect. Refer for AFB, refer for chest X-ray, refer for TB treatment, and then you want to choose the preventive therapy if the client is going to be on any preventive therapy, either CPT, TPT, or both. So for now, we are not going to choose any, and I'll click on save. Sorry. So the therapy, I'm going to fill it back. So you see the kind of errors that I keep having when I don't fill in the fields correctly. And the reason is the system needs the data to be complete. And so every time we fill in this information, we want to make sure that whatever we're collecting is correct, or it will be rejected. So I'm going to put in back all of the values. Okay, so now it's saved because I put in all of the information that is required. Once you fill in the symptomatic checklist, because it is an encounter form, the form is cleared out for new values. But if you want to look at the previous checklist, you can come to previous symptom check, and then it gives you all of the values that was filled previously. So it continues to populate this form with every new value with the most recent first. So this is the first time we fill in a symptom check, and we have the record here. So when you fill the symptomatic checklist, you can look at the previous symptom check here. So now you want to look at the diagnosis and category. We'll put in the record date. The diagnosis of this client is based on the screening, we'll say pulmonary TB, and the criteria is confirmed. The diagnostic category is new. So you will see that you have different diagnostic criteria. Yes, you have the value for previous mantle test, and I'll show you shortly. So we have diagnostic criteria here, and we have diagnostic category. So if you have new, relapse, transfer in, previously treated with unknown outcome, treatment after failure of first-line drugs, treatment after loss to follow-up, and treatment after failure of retreatment regimen with first-line drugs. So this is a new client, and I'll click on save. Now this is a one-time form, so it retains the value for you to update in the event that you entered anything wrongly. The drug resistance testing. So Jennifer, I'll go back to your question. If you come to TB screenings, you will find the previous values that was recorded. If you need to screen again for TB, let's say this was just a mantle test, and we want to record the result for a different type of screening that was done. So we'll do the gene expert, and the result is MTB detected, RIF, let's put resistance for demonstration. So once I fill in the new screening value, you'll have all of the history of values here. So the next thing to do after registration, symptom checklist, diagnosis and criteria, you go to drug resistance testing. If you are doing separate drug resistance tests, apart from the rifampicin resistance that was done along with the screening, you will fill them in here. You keep adding rows until you fill in all of the resistance results. So we only have one resistance, and it was resistant, and you save this. So we have this already previously recorded from when we recorded it previously. So you have the history or the whole recordings for drug resistance here. Then you can move to treatment. When we look at the treatment, the form gives us 3 types of information. Above, we have most recent prescription history. This is only populated when the client goes to the pharmacy and picks up a medication. Then it shows the date of dispense. If you prescribe a medication for the client, so let's assume that we are going to give this client. So I will select any medication for now. So this is new, but we're just going to use continuation for demonstration. Let's put duration to be 18 weeks and screen for right now. Okay, and so I will save this. So because my treatment plan included, I put a prescription. It is there on the treatment history. But here, there is no record that this client has picked up this medication from any pharmacy using the system. So if the client comes back on the next visit and you still don't find the prescription pickup history here, then you want to find out if the clients actually picked up the medication and has taken them. And you want to be sure that maybe it's just the pharmacy that did not record that, but the client actually got the meds and took it. So you have the history of previous prescription here, and it's going to put in all of the histories that you've ever given to the client or any doctor has given to the client. And any medication that has ever been picked up from the pharmacy will be listed here, regardless of who prescribed them. As long as the pharmacy records that dispense, you'll find it here. Treatment monitoring. Now, because we say on the next visit you want to do an evaluation, so there are a list of screenings, and I will change this to have an exhaustive list, but you can come here to other screenings to request any type of screening that you want, not on the list. So while configuring your system in the countries, you might want to get the exhaustive list of screenings from the lab, and then you list them as type of screenings so that this menu will be populated with the type of screenings that you do. So this is an exhaustive list from a lab, and you can select whatever you are monitoring for the client. So let's say I want to do bone, or let's just do renal. And here we are awaiting results because I'm just requesting. So the next time this client comes, I want to find out if this screening has been done. Sorry. So I want to find out if this screening has been done, and I want to get the result. So I'm going to come back here to the treatment monitoring. When you are monitoring your treatment, you select evaluation, you will get the monitoring history here. And when you want to look at the different adverse side effects from the client, you can look at the list of all the possible adverse side effects for the TB medication you have prescribed, and you click on save. And when you want to look at the side effects management, you are going to check here to see the side effects management. Yes, we can do vitamin B folate level, and it's part of the screenings, so you have it here. So we have the B12. So this list is going to be configured by you in the country. So it's not a list that the system auto-populates. So we have looked at all the TB management functionalities. The flow is this. For a new client who is coming for the first time for a TB case, you will do the registration information, the symptomatic checklist, the diagnosis and category, the drug resistance testing, the treatment monitoring, adverse effects and effects management. You can look at the previous symptom checklist. You can record vital signs if you need that here. Sorry, I will change this just now. But if the client is coming for subsequent visits, you are doing your symptomatic checklist, you are going to treatment, then you are going to treatment monitoring, adverse effects and effect management. So I'm going to write this out in a workflow that I will email later on. So this is all about the tuberculosis functionality, and this functionality is for TB clients that do not have HIV. But it allows you to screen for HIV, see the HIV results, and refer for HIV treatment if the client comes down with HIV later along the line. Any questions before we switch to HIV?
Not a question, Mildred, but I like the fact that TB in positive for HIV has to have a TB test, vice versa. So to monitor that aspect and to get the screening and the risk and all of that for HIV, for the TB patient, that really makes it easy for us, seeing that TB patients must have an HIV test, vice versa. So I really like this here.
Okay.
Everything in one place.
All right. Thanks. So any more questions?
Hi, good morning. Mildred,
Good morning. Yeah.
On the diagnosis and category, that is category at registration, whether it's a new case, whether that's, yes, let me see, really. Okay, good. Now, at the end of treatments, or do we have an area where we say outcome so we can also categorize the person, whether it's a failure, whether it's successful treatment, or whether the person died, like an outcome category? Do we have that?
No, we don't have that, but I can include that after this training. So I will include it under the treatment here, and I'll just put an outcome tab.
Right, yes, category, thanks.
Okay. Okay. So before we go on to the HIV and other STIs.
Just a sec. Good morning.
Good morning.
This is Denise from Health Information, St. Lucia. My question is a little more general. I noticed that, and I'm a developer, so, well, I'm looking at it from that aspect. I noticed that your dates are split into 3. So that's like 3 different entry points for each date. And also, a little while ago, I saw you put in an entry, like you selected a few fields, but you missed out one field. And when the form reloaded, it didn't keep any of the information. You had to do it all over again. Now, I've not gone through a lot of these screens, but I see that some of them can be quite extensive. So from a user's perspective, I'm wondering, can it be formatted so that if you're missing a field, it does not empty out everything that you put in, that you have to redo it? Right. And the date option, I don't know in terms of the multiple entry, like the 3 entries, if there's a difference in the date. Although the screen that you did show, you said it's a one-time entry, but I assume that that's going to be the format for dates across the application. So I wonder if some consideration can be given to that in terms of making it a little less let's say user, like for the user, so that they're not spending so much time doing the same thing, or if there's a more optimal way for them to do it.
Okay. So for the dates, you will notice that some of them have a calendar where you select dates. Those are fields that are not date sensitive. So there are events where somebody will tell you it was in 2019, or when you're entering past record without a month or a day.
Right.
So for those type of forms, we split the day, month, year, so that the user can enter any of the available times. So if you only know the year, you can ignore the day and the month.
Oh, I see.
But in calendar form, you have to select a day. And
understood. That one, yeah.
Then for the other one of repeats, I will just put a JavaScript block that will just require that the field is submit before submission, so they don't have to lose the data for those ones.
Okay.
Yeah. So all of them can be updated after the training.
Mm-hmm.
All right.
Thank you.
All right, you're welcome. So any more questions? Okay, so the next functionality is a little bit more complicated than this. So we are going to take a 15-minute break. We are going to come back and then we'll look at that before we round up. Is everybody okay with that?
Yeah.
All right.
Yes. Okay.
Okay, so before the break, we looked at the tuberculosis care card and the tuberculosis functionality. That care card we looked at previously only holds information for TB. There is another kind of clinical management which deals with other STIs, and this is scheduled for next week's training, but I will show you before we move on. So as always, you come back to your pages menu and you come back to clinical management submenu here, other care card. For other STIs, you don't need to go through the appointment and creating a visit. You just need to put in a unique ID. So I will assume a client is in front of me and the client has a unique ID that I've just been given, and I will get care card. So for other STIs, we are going to be looking at the following. You have every file from all health centers transferred. And the reason for this transfer is there are some of these screenings and managements that are integrated into primary health care, so that if the client is having this treatment from a health center, they do not need to go through the HIV. But then they have flags for HIV screenings and for syphilis screenings, and you can also always come back to the tab to do the screenings and record the results or view the results of the screenings if they're done. What this looks at is hepatitis for people who confirmed hepatitis positive, either B or C, the diagnosis and diagnostic category. For HCV, for people with hepatitis C, we look at the genotype and the comorbidities, the risk factors, and also the comorbidities for hepatitis B. And then we look at chlamydia, gonorrhea, syphilis, all stages of syphilis, and other pelvic inflammatory disease. And then the treatment plan, treatment monitoring, adverse drug effects, and effects management. So this is not part of today's agenda, but I want to mention it before we go back to HIV for clients who are going to be referred for other STIs that is not HIV or TB. So I will switch back to HIV management. So we look at the list of waiting clients, and we have a client who is here for HIV clinical care. We're going to take the unique ID for an adult client. And then I'm going to come back to clinical management and come to HIV care card, put in the unique ID and get forms. So we already introduced this. You get the flags for CD4s and viral loads. We said that CD4 is due 3 months from the last CD4 test, and viral load is due 6 months from the last viral load test. We also get the trends for CD4s and viral loads that have been recorded on the system with the dates. We get the trends for the BMI, and we'll also get the adherence assessment report. If there is a result for HIV drug resistance testing, it is going to be displayed here with the drug names, the type of mutations, the resistance on genotypic testing, and all other scores. Then you get some basic demographic information as the unique ID of the client, the biological sex, and the current age of the client. The last recorded vital signs will be displayed also. And then you have a container that holds all of the forms that you are going to be using for this visit. If you need to repeat vital signs, then you can record new values here, but the right side gives you the history of vital signs for the client. The next form that you use at every clinical management visit is the adult or adolescent symptom review. So the forms for adults and adolescents are the same, and the forms for pediatric and exposed are the same. The adult symptom review, we're going to start filling this 15th of February, 2022. Presenting complaints. So let's say this client comes in for clinical management and only complains of fatigue, or let's say tiredness, always tired, or anyhow you put it. The additional comments, if you have any, detailed findings when you do your physical exams. If you have detailed findings, you type them here. So you want to look for any new opportunistic infections or other problems. The client, let's say, has fever. The client has cough and shortness of breath. You want to find out from the client if they are sexually active and on any type of family planning. So let's say this client says he is not using any family planning method. If you are filling this form for a client who has been lost to follow up or transferred out or dead, you want to fill in the patient's disposition. And this is not applicable. Is this client asymptomatic, symptomatic, or you are suspecting opportunistic infection? So the client is symptomatic and we are suspecting opportunistic infection. So what's the plan? You want to do a lab evaluation, you want to screen for tuberculosis, you want to send for adherence counseling also, and you want to do symptomatic treatment or pain management and opportunistic infection therapy. So you select what your plan is, and if you have other plans, you will write them out in the notes I'll show you later. If you are going to put this client on ARV, or the client is already on ARV and you're going to fill out a new prescription, you are going to select continue current treatment. If you are going to restart treatment, you restart treatment. If you are not going to be giving any treatment, you just want to monitor, ongoing monitoring, and ARV treatments not indicated. If you are starting a new treatment, start new treatment. If you are going to monitor and you are postponing prescription of ARV because of clinical reasons, you're going to select that. If you are going to change treatment, maybe due to treatment failure or drug resistance, change treatment. And if you are stopping treatment, maybe based on non-adherence or any other condition, stop treatment. So we are going to start new treatment. So you select the treatment regimen. You can select multiple, you can select one, as much as you are going to be giving. So let me just assume we're using this alone. If you are giving other treatment, you type it in here. But if not, you are going to click on save and you are done with so symptom day is unknown. So I'm going to do what the IT person just said to prevent us from filling the form once we miss something, because I know I did not do that here on these forms, but I will update that after the training. So we get the idea. I really don't need to fill this back in, but that is the whole idea for filling up this form. The TB symptom checklist is exactly the same thing with what we saw in the TB. So the symptomatic checklist you also use for HIV clients. I don't know what the rules are in the country, but you need to periodically do the TB symptom check and select if the client is going to be on any preventive therapy or is being treated for TB. The update CD4 or viral load is used when the client has a new CD4 viral load result and you want to update it on the system. So you fill in the dates. You put in the most recent CD4 value. So let's say this most recent now is 220 and the viral load is now 20,000 copies per mil. And I will save this. Another thing you need to fill in at every visit is the clinical staging. So I'll take this again. The vital signs is optional if you want to repeat the vital sign that was done by the nurse before the client came in. The symptom review is a form you use at every clinical visit. It's an encounter form. So when you fill it, it clears out and you go to previous visits to see the care card. The TB symptom checklist you use based on the timing between symptomatic check that you do in your clinic. It is not required for every visit. It is required based on your standard. You update CD4 and viral load if you have new values on that visit that you want to input into the system. The adult or adolescent clinical staging is a form where you select the symptoms that the client has and you state the client based on the symptoms. So we want to say this client is in stage 1, and we select this is the only thing we have seen. He doesn't have any of all of this. But the client also has cough, but doesn't have any severe weight loss, doesn't have any, is not confirmed for tuberculosis yet. So this is the only thing we have. The client has very mild symptoms. So I'll put in the date. And I will save. Once you do the clinical staging, you want to fill in HIV adverse drug reaction in the event that the client is on ARV and the client is complaining of side effects. So there are pre-listed list of reactions, and then there is also an empty box where you can fill in new adverse drug effects that is not on the list. We have the mental health assessment or evaluation form. And this form, I was told that is a standard that every 3 months when a client is on ARV, you want to do a mental health assessment for the client. In yesterday's workshop, there was a recommendation that we update the form to make it less, to make it more user-friendly. So that has been done, and I will describe that. This form uses the DSM-5 categorization of mental disorders, and it checks for 15 domains of mental disorders for clients. We check for depression, for anger, for mania, for anxiety, for trauma, for suicidal ideations, for psychosis, for sleep problems, for memory problems, for repetitive thoughts and behaviors, for stigma, for personality functioning, substance use, sexual behaviors, and dissociation. For all of these domains, if the domain score for suicidal ideation, psychosis, and substance use is greater than 0, you want to inquire further or refer to a psychiatrist. For the rest, if the domain score is 2 or greater, then you want to evaluate further. And I'll tell you how that domain score is calculated. You have the record date, which is today. And so the questions here are optional. Was the client incarcerated in the past 90 days? So we'll say no. If the client is on HIV medications, you want to ask if the client is on one prescribed. If the client's adherent to the medication, so we've not given yet, so we can leave this blank for now, since we are not going to answer questions based on medications, since the client is going to be getting medications at the end of the day. So all of these current medications will not apply, except if the client is on psychotropic medications and you want to check the adherence of that. You want to look at some risk behaviors in the past 90 days for unprotected sex. Let's say he said yes. Illicit drug use, he says no. Any sex without disclosing HIV status, he said yes. So we want to look at the major category of mental disorder, but you are going to select what you are assuming is the category you are suspecting based on your discussion with the client, but you'll do this after the evaluation. And so let's do the assessment measurement. So the first domain looks for depression, and depression has 2 questions. And you're going to ask the client, in the past 2 weeks, have you had little pleasure in doing things? If the client has not at all, 0, sometimes maybe less than 2 days, just 1 day in that 2 weeks, 1. If several days in the 2 weeks, 2, more than half of the 2 weeks, 3, and nearly every day, 4. In this domain, there are 2 questions. So when you Select a score for each of the questions. There is a highest domain score box here where you record the highest score for this domain. So the client says he has had little pleasure in doing things throughout the 2 weeks. The client says he felt down, depressed, and hopeless just in the first week of the 2 weeks. And the highest domain score here is 4, so we record 4. Now, because the threshold for referral or further evaluation for depression is mild or greater, once you have the highest domain score greater than 2, you want to probe further for depression or refer the client to a psychologist or a psychiatrist to do further evaluation on depression. The second domain is anger. It asks one question. Have you felt more irritated, grouchy, or angry than usual? He says no, so the highest domain score is 0, so there is no need for any referral. We have mania. Have you slept less than usual, but still have a lot of energy? Let's say he says just some days, like less than 2 days, just 1 day. And have you started lots more projects than usual or doing riskier things than usual? He says no. The highest domain score here is 1. For anxiety, have you felt nervous, anxious, frightened, worried, or on edge? He says several days he feels that way. Have you felt panic or were unusually frightened? He says all the time. And avoided situations that made him anxious? He says all the time. The highest domain score is 4, so the client will be referred for further evaluation. Trauma. You want to ask, have you directly experienced or witnessed a traumatic event? He says no. Have you attempted to avoid distressing memories, thoughts, or feelings about closely associated with the traumatic event? He says no. The highest domain score here is 0. Suicidal ideation. Have you had serious thoughts of hurting yourself? He says no. Psychosis. Have you heard things other people couldn't hear, such as voices, even when no one was around? He says just 1 day. And have you felt that someone could hear your thoughts or that you could hear what another person was thinking? He says several days he feels that way. So I want to find out if he has sleep problems. Have you had problem with sleep that affected your sleep quality overall? He says most of the time he's always sleepy, so we'll say no. So let me record the highest domain score here. So have you had problems with memory, that is learning new information, or with location, finding your way home? He says no. The highest domain score is 0. Repetitive thoughts and behaviors. Have you had unpleasant thoughts, urges, or images that repeatedly enter your mind? He says sometimes. And have you felt driven to perform certain behaviors or mental acts over and over again? He says all the time. When he locks his door, he checks 10 times whether he really locks it. So put 4. Stigma. Have you felt that people treated you differently because of your HIV status? He says yes. And have you felt out of place in the society or that you do not belong? He says yes. Personality functioning. Do you not know who you were, or is there a time that you don't know who you were in the last 2 weeks? He says no. Have you not felt close to other people or enjoyed relationship with them? He says most of the time or several days in the week. So 2. Substance use. Have you drunk at least 4 drinks of any kind of alcohol in a single day? He says no. Have you used any medications or medicines on your own that is without a doctor's prescription, or greater amounts or longer than prescribed, or illicit drugs? He says he did that for some days. Have you tried to reduce or stop your drug or alcohol use? He said he tried. Have you engaged in sexual activity to numb painful feelings or memories to reduce anxiety? He says all the time. So the highest domain score now is 4 here. Sexual behavior. Have you felt guilt or shame either before or after engaging in sexual activity? He says no. The highest domain score is 0. And dissociation, have you felt detached or distant from yourself, your body, your physical surroundings, or from your memories? He says sometimes. And so you save this. This is how you fill in the mental health assessment. You'll use this threshold guide to know what you want to probe further or evaluate further, or if you need to refer the clients for further evaluation for mental health. So again, for suicidal ideation, for psychosis, and for substance use, once the domain score is greater than 0, you want to refer. For the rest of them, if the domain score is 2 or greater, then you refer. And then I'll click on save. Okay. If at the lab, investigation reports was requested and uploaded, you'll find the uploaded report here. If there is an uploaded drug resistance test information, you'll find the uploaded information here. So these are just to view reports that were uploaded. But this ends the functionalities that you have to use during clinic days for HIV management. Again, I'll go over it. You can record the vital signs again if you want to repeat the vital signs. You need to do the symptom review at every visit. You need to do the TB symptom checklist at every visit. You upload the CD4 and viral load if you have new results. You do the clinical staging at every visit. You want to check if the client is on ARTS and the client is having side effects. You want to fill in the advanced drug reaction form. You want to do the mental health assessment or evaluation on every visit, especially for clients on ARTS, regardless of whether they're HIV positive or not, as long as they are placed on the medication. If you want to look for investigation reports, if they are uploaded, you'll find them here and you click on view to view the report. And if you want to view drug resistant information, if you have an upload, you will find it here. This ends the adult care card for HIV management. Any question before I move to pediatric and exposed infants? Okay, so I will assume that there is no questions, and I will look at the waiting clients and take a unique ID for a pediatric client. So we have this client is pediatric, G1234, and I will come to HIV care card. So for the pediatric care card, you have exactly the same flags as the adults. The flags for CD4s and viral load, the trends in CD4s and viral load, the BMI trends, the adherence assessment reports, and then you have the results for drug resistance testing for HIV drug resistance test. You have the basic information has the unique ID, the sex, and the current age of the clients. And then you have the vital signs, the last recorded vital signs for the present day. The first tab is the same as the adult, where you have forms for vital signs and statistics, and then you have the right side of the form having the history of the vital signs that was recorded. If you need to repeat the vital signs, you can fill it in on the form. The pediatric symptom review is different from that of the adult. This checks for fever, weight loss, or night sweat, irritability, difficulty sleeping, headache, and refusal to eat, and every child-related kind of irritability problems. Then it looks at the developmental assessment of the client. So if this is a child who is maybe a toddler or less, you look at the gross motor, the fine motor, the speech, the social behaviors, and then you want to fill in the presenting complaints and additional comments, the past medications, the drug allergies, the family history, And then you want to assess if the client has lost developmental milestone. You want to find out if the child is in school, the name of the school, if the child's performance in school is satisfactory, if the child was breastfed, you want to know the duration of breastfeeding. If the child, you want to ask the mother if this child had mixed feeding. If this child has received any treatment from a herbal healer or a traditional center that is not medical, you want to fill in the current medications at or anti-TB meds or on prophylaxis for TB. You want to also look at the side effects of medications if this is a child who has been on ART. Then you do a physical exam. The physical exam for the child is exhaustive. We have a physical exam by organ system. So you look at the general appearance, the gland, the respiratory, the skin, the gastrointestinal, the cardiovascular, the head, eye, ear, nose, and throat, the mental status, the breast, the genitalia, neurological, and any additional findings can come in here, and your assessment and your plan. So the child has a symptom review form that is more comprehensive than that of the adult. The TB symptom checklist for the child is exactly the same as that of the adult. The pediatric ART care card only fills in information of the nutrition, the developmental status. So it's going to, you're still going to fill in what you filled in here, but you're filling in just the nutrition if the child is on regular diet, and you want to select the developmental status at this visit. If the child is developmentally accurate, if the child has developmental delays and doesn't meet criteria for the age, and the criteria is listed on this form down here, or if the child has a loss or arrest of milestone. Once you fill that in, you want to fill in if the child has any opportunistic infection, if the child has started ARV, the ARV regimen you use. So you put both for TB and for HIV, and then you are also going to select if the child is going to change medication or stop. And if it's not applicable, not applicable. The recent HV values and the ALT value for children who are already on ART and are coming for subsequent visits, and then you save. The CD4 and viral load form is just the same as that of the adult, where you record the most recent values that you have. And if not, you don't bother about the form. Then the pediatric clinical staging is different from the adult in terms of the kind of symptoms to expect. And so you select what symptoms the client has to place the client under a clinical stage. The HIV adverse drug reaction is the same as that of the adult, where you select what adverse drug reaction the client has and you save. If you have uploaded investigation reports, it comes in here. If you have drug resistance information, it comes in here. So in summary, for a pediatric client, the symptom review, the ART care card, and the clinical staging are the three forms that are different from that of the adult. And these three forms are forms that you need to fill in at every clinical visit. The rest are optional or based on your practice in your country. If you do the TB symptom check at every clinical management visit, you fill it in. If you have CD4s and viral load values at the visit, you fill it in. If the client complains of side effects, you want to check and monitor for adverse drug reaction. And then you can view investigation reports and drug resistance information. And this concludes the pediatric care card for HIV clinical management. This is exactly what it is for the exposed infant. The difference between pediatric and exposed infant is that the pediatric client comes in from a health center. The client tests positive. The client was not an exposed infant. For the exposed infant, we looked at it last week that when an exposed infant is born, the clinical care team or the clinical care nurse registers the exposed infant, and we use the care registration and initial evaluation functionality to do that. When you expand that menu, you will find exposed infant care registration. When that client is registered, you have exposed infant evaluation, which is next. I am going to look at the previously registered exposed infant. So we have that on the list. So I'll take this client who has been previously registered. And I'm going to come back to the initial evaluation for that exposed infant. Every time this exposed infant comes for clinical management visit, you review the forms and fill the form. So this was last week's training where we enrolled the exposed infant. We looked at the screenings and then we do the immunization. We want to assume that this exposed infant on today's visit, the exposed infant is 7 weeks old now. And the client is going to have the result from a PCR that was done. And that result is positive. So the first screening was negative. The second is now positive. Once an exposed infant is positive, you don't need to do anything further like referral. Just go straight back to appointment stroke patient monitoring and schedule a new appointment for the exposed infant. So we already have an appointment for this, but I will just repeat it. HIV clinical management. So the client already has pending appointments because we did that earlier. But this is how you schedule the appointments for an exposed infant who now has a positive result. Once that appointment is there, if you view pending appointments, you will see that the same exposed infant, J123 David, has an appointment for today already. So I will come to create visit, just like we did for all the other clients. And I will put in the exposed infant ID and start visit. So the temperature is, let's say, normal. The blood pressure, I'll use any value here. The pulse is 89, the respiratory rate is 12. The weight of this child is, let's say, 7.5 pounds. The length of the child is now 53 cm. And the BMI is calculated automatically. The head circumference of this child is, I'll use 33, chest circumference 32, mid upper arm circumference, I will make it 11.5 so that the child will be malnourished, and send. So now that we have created a visit for this child, the child is going to appear under waiting clients. So we have J123 David, and now you can come here to get the HIV care card and put in the ID. And then you get the care card. Everything on the care card is exactly the same as that of the pediatric clients. The process to get the care card is what is different. So for the exposed infants, you just come straight to appointments, create visits, get the care card. For the pediatric clients, the client has already been registered previously, so you go through the same process. The exposed infants do not need a separate registration into care if they turn positive. You just need to get them a clinical management appointment to start clinical management. And then you get all of the forms for pediatric symptom review, TB symptom checklist, pediatric health care card, pediatric clinical staging, just as we saw when we looked at the pediatric clients. And this concludes all of the clinical management functionalities. Next week, we are going to look at management of other STIs and opportunistic infections. This concludes today's agenda. I will take questions and recommendations. Feel free to give any recommendation. If it's a change in structure, a change in design, feel free to answer. I will update the system as soon as I get recommendations.
No questions for me. I'll keep practicing with today's class afterwards, and I will practice what I missed yesterday.
Good morning. Was yesterday the same as today?
Yes, yesterday was the same.
Oh, okay. All right. Then good. I'll just practice.
Because I missed yesterday too.
Yes, yesterday is the same as today, but today is more comprehensive than yesterday because there were recommendations yesterday that was updated. And then yesterday's recording was just halfway. So
okay,
you might want
understood.
So I'll post today's recording sometime before the end of the day. So you can use today's recording instead of yesterday's. Then tomorrow and Thursday will be a repeat. So tomorrow is going to be a new session. Thursday is going to be a repeat of tomorrow. So if you can join tomorrow, clinical management, you join. If you can't join tomorrow, you can join on Thursday.
I have a catering job tomorrow, so I will follow on Thursday.
Okay. And so we have the last clinical management session next week. And I will, if you check the schedule, I will update that over the weekend, but it's already on the schedule for the last part of clinical management training for next week. So you have 2 more sessions, tomorrow or Thursday, and the one of next week. Any more questions or recommendations?
Not from me.
Okay. So if there are no questions, we are going to do introduction since we have some new people. My name is Mildred Fakoya. I am a systems developer for health and education systems. I'm a software engineer and a data scientist. I am also the developer of this system.
Kevin Gregoire, a volunteer attached to the National HIV/AIDS unit here in Dominica.
Lester Guy, NAP Manager, Dominica.
Judy Nesbitt, CCC, Nevis, St. Kitts and Nevis.
Cleona Peters, physician at the Infectious Disease Clinic, Dominica.
Karen Anderson, HIV case manager, Antigua and Barbuda.
Jennifer Joseph, chemist coordinator and clinical nurse, IDC, Dominica.
Glover Williams, St. Vincent, infectious disease clinic nurse.
Good morning, Stephen Adifaja Milaine, a doctor and a guest on the training.
Okay, so we are done with the introductions. Thank you all for attending, and I will see you tomorrow or Thursday. Have a very good afternoon.
Okay, good
Same to
afternoon.
you.
Bye.
Pleasant day, everybody.
All right.